Blog Talk Radio.
We are the UR Tennis Network. Our mission is to be the voice of tennis. We enlist a team of passionate enthusiasts to promote our sport. We strive to bring interesting perspectives on the many spins of tennis. Our goal is to provide the learners of our sport with current news and information from many angles. We seek active participation from communities interested in tennis, but tennis is not interested in them. We are expanding our outreach. Tennis is a true lifetime sport that needs to be talked about, and the UR Tennis Network pledges to pursue this idea relentlessly.
Good afternoon and welcome to the Parenting Aces radio show on Blog Talk Radio's UR Tennis Network. I'm your host, Lisa Stone, and I am coming to you today from sunny Southern California. Phase 2 of my son's and my summer tennis travels. We have been on the road a lot this summer, and it's been a blast. But today I am bringing you kind of a different guest for our show. I have on the air with us today Dr. Jed Jones, who is an orthopedic surgeon. He is a hand specialist, and he's also a tennis player. So he is going to bring us some very interesting information and perspectives on injury prevention, injury treatment, injury recovery for our junior players. And I think it's going to be a very informative show. I know I'm very interested in hearing what Dr. Jones has to say today because, you know, our kids are out there beating themselves up on the court for several hours a day, most days of the week, most days of the year, and injuries are just part and parcel of the process, unfortunately, for most of them. So I think it's really important that we as parents do what we can to help prevent those injuries in the first place, but also understand how to help our children effectively get treatment and recover from injury, and knowing when it's time for them to resume training and competition and when it's time to take a break. And so before I bring Dr. Jones on, I just wanted to give you that little bit of information. But Jed, thank you so much for being on the air with us today, and we're recording this on a Sunday afternoon, so I appreciate you taking time away from your weekend to be with us as well.
Oh, it's my pleasure. Thanks a lot for accommodating me as well, and happy to be here.
Well, great. Well, so before we jump in, why don't you just give my listeners a little bit of background on what you do, your specialty, and your involvement with tennis?
Yeah, well, I grew up here in Las Vegas, Nevada, where my practice is based. So I'm a native of Las Vegas. I grew up playing tennis and played pretty much all my life through high school. Didn't play in college. I played intramurals in college and stuff. And then I kind of laid off the tennis for a while once I got really busy with school, medical school and residency and all that stuff, and sort of picked it up again. But, you know, a little bit about me, professional-wise, I'm an orthopedic surgeon, as you stated, but I also did a fellowship in hand and upper extremity surgery. So in addition to being board certified in orthopedics, I'm also have added qualification and certification in hand surgery. And I treat all aspects of the hand, wrist, and elbow. I do a little bit of shoulder, too. I see, because of my involvement in tennis and my love for the sport, I tend to be attracted to those types of patients, and I've worked pretty extensively with a lot of, younger tennis players as well as adult tennis players, and have a lot of fun treating the issues that those players face.
What's the most common injury that you see in your practice?
The most common injury, I would say, if we're talking everything in general and not necessarily tennis, I'm a hand surgeon, so I see the bread and butter stuff like carpal tunnel and trigger finger and tennis elbow and wrist fractures. And I would say the majority of stuff that I treat is probably wrist-related somehow, either dealing with, overuse injuries, tendinitis, fractures of the hand, you name it. We've got a pretty comprehensive practice. So yeah, if it comes, when. Yeah.
Sorry, go ahead.
Go ahead. I'm sorry. Well, I was just saying, if we're talking about tennis, especially at the junior level, then I see a lot of kind of overuse type injuries, and a little bit of tennis elbow, although that's a little more rare, especially in the junior population. But wrist pain and that type of thing is pretty frequent.
And the overuse issue is something that's being written about a lot right now, and early specialization in sports and how that can lead to overuse injury, not to mention burnout with these kids. And so maybe you can talk a little bit about from a physiological standpoint, what is overuse? What does that mean, and how does it kind of show itself physically in the body? What are some signs that parents should look for? Yeah,
so overuse is sort of a nebulous term. I mean, it's sort of an all-encompassing term as well. But it sort of can include everything from inflammation of tendons or tendinitis to inflammation of tissue within the wrist joint, to inflammation or irritation of the growth plate. When we're talking about the junior or pediatric population, younger than 18, most of whom are still growing or still have open growth plates, then it also, you have to think about, you have to look at it this way. Physiologically, obviously, kids are different than adults because they're growing. And when it comes to, sort of the orthopedic issues that I see in the pediatric population or in the younger population, you have to take into consideration that these kids still have open growth plates. And what I mean by that is that their bones are still growing. The growth plate is an area where the bone is how the bone grows. It's an area of cartilage. It can get irritated and inflamed or even broken, just like any other tissue. And because of that, it poses, unique problems. And it's not uncommon, especially in these kids who are becoming very specialized in sports, whether it be tennis or baseball or especially baseball, especially tennis and baseball, those two sports. Then with sort of these repetitive swinging motions and throwing motions and things like that, you start seeing a lot of irritation of the tissue around the joint, irritation of growth plates, and so it's sort of a unique set of issues that we're dealing with. And they're treated, kids are treated differently than adults. But overuse, and I was just going to say overuse is, so like I said, kind of getting back to my original statement, overuse is sort of a nebulous term, but oftentimes, more often than not, especially in the junior population, it usually means some type of irritation of the joint or the growth plate.
Okay, and so for a parent, when your kid comes home and says, "Mom, my arm hurts," or "My wrist is bugging me," how do we know when that warrants, just icing it or giving them some Advil to reduce the pain, or taking them to somebody like you who can do a thorough exam, maybe X-ray, MRI, etc.?
Yeah. Well, first I want to say that my mantra has always been that the kids very rarely fake injuries, and I learned that from one of my mentors, a pediatric orthopedic surgeon at Indiana University, and so kids have very little secondary gain, unlike some adults who may complain of pain, and I'm not saying all of their complaints have secondary intentions to them, but you really have to take seriously, and what I'm trying to say is you have to take seriously the complaint that your child has, that his knee or his elbow or his wrist hurts. I don't think it's a good idea to just sort of, especially if your child's involved in one of these sports, pitching or playing a lot of tennis and they're complaining of their arm or elbow or knee hurting, you kind of have to take it seriously. It doesn't mean that you have to rush them off to the emergency room, but rather than blow it off and say, "Oh, hey, suck it up, Johnny. You just got to be tough. No, I think the first step, if it's a relatively minor thing, and if there's no history of falling down or trauma, if it's just mainly one of those things that the next day they're complaining of pain, or they're getting done with practice and their elbow really hurts, or wrist or something, I think it's perfectly warranted to rest, to ice especially, to give it a little time. I mean, if they have a big practice the next day and their arm is still really sore, look, there's no sense in pushing it and having them and forcing them to work through that practice with a sore arm or elbow or hand or whatever. So I think rest first and foremost should be the rest first off should be the first mode of treatment, I think. Maybe some anti-inflammatories. And then, of course, if the problem persists and it gets to the point where, you're going several days now and the arm is hurting so much that they can't even pick up a racket or swing a bat or something like that, then that's when you need to start thinking a little more seriously about maybe getting in to see your primary care physician or an orthopedic surgeon, and saying, look, is there something here that we need to check out? Is there some type of splint? Is there anything that we need to do, work up a little more seriously? Oftentimes the majority of these types of overuse injuries are simply cured with adequate rest. Kind of depends on how severe it is, but usually adequate rest, the occasional, ibuprofen or Motrin or Aleve or something. But I think rest first and foremost is the mainstay of treatment.
And when you say rest, does that mean, absolutely no activity on that part of the body? And for how long? I mean, do they need to be pain-free 24 hours? Do they need to be pain-free for a week? How do you judge that?
Well, if you haven't seen a doctor yet, then I think what most parents should do is ask the child. I mean, let's say somebody has, a child has pain in his wrist after tennis practice one day, the next day they have practice, but the child is having so much pain that he doesn't feel like he can pick up a racket. Then I think that it warrants more than just a day of rest. I think resting a few days is probably warranted. Initially, if somebody complains of a sore joint, it usually takes more than just simply one day of rest. I would say that if the problem persists and gets to the point where they have trouble even picking up a racket, or the pain persists for several days, or it seems to be very activity related, say like they just have pain when they pick up a racket and start swinging or doing a backhand or forehand or something like that, and the problem is not going away and seems to be getting worse, then it's probably going to require a workup with the orthopedic surgeon or a specialist, and just to grade the severity. And that's kind of where I feel my role is trying to kind of grade the severity of the injury. I can, just through my experience in treating patients and stuff like that, I can kind of palpate the sore spot, look for any swelling, look for any signs that may be worrisome, and I can tell the patient as well as his or her parents that, look, this is a relatively minor tendonitis. You've got this. It usually takes several days to several weeks to get better. So I would say that my rule of thumb, I suppose, is that if the pain persists for several days and they don't feel like they can participate in the sport, because of the pain, then that's the time that they need to go in and see somebody. So a lot of it is very subjective.
Gotcha. And there are, I would guess, some injuries that are, more serious than others, obviously. Some things you can continue to play with and not aggravate further, not do any additional damage. But other injuries, you have to be really careful not to cause further problems than what's already there. So I think as a parent, that's always been really challenging for me, is trying to help my kid figure out, this is just something that's par for the course, and you're not going to hurt yourself any worse by continuing to play, versus something where you really can cause some more long-term damage.
Yeah.
Is that something that a physician needs to evaluate? Help us out.
Sure, and I think that I think that anytime you have a concern, anytime a parent has a concern, anytime a player has a concern, I think that's justification to go in and get an opinion. Going in and speaking with your doctor or orthopedic surgeon and getting an opinion to assess how severe it is. And I have plenty of patients that come in, plenty of parents that come in and want to talk to me about, their child's particular condition. And it may be something as just, as simple as just a very mildly irritated wrist that gets better within a few days or even the next week. Or it may be something more severe. So, very rarely, I would say, with overuse injuries, is there going to be anything permanent that is going to cause long-term implications into adulthood. I think that when we're talking about long-term problems that are carried through into adulthood from the pediatric population, we're usually talking about growth plate issues. And a lot of those growth plate issues are associated with fractures, trauma somehow, and that's typically not seen, or at least I typically don't see those types of injuries coming from tennis necessarily. I see that quite a bit in some of the gymnasts, that I see that have this constant pounding and compressive trauma to their wrists who can actually disrupt their growth plates. I think that's less of a concern in the racket sports. And so I don't think there necessarily has to be a concern, again, of any long-term implications. But I say this, anytime, because everybody's different, and every child has a different pain tolerance. Every parent has a different tolerance in terms of what they can put up with and that type of thing. So, if you have a concern, it certainly is not any trouble to just come in and talk to somebody, and to get an opinion as to how severe it is, rather than trying to guess on your own.
Right.
I think most people, just common sense will tell most people that, hey, this may just be due to, if you wake up with some soreness in the morning because you had an intense practice, that's one thing. And I think most people can tell what soreness is. And then most people can tell also when it's a little more serious than soreness. And I'd say if it's a little more serious than just the routine soreness, then it certainly doesn't hurt to get an opinion.
Right. And now, we've heard from time to time about growing pains, and especially with kids that are playing at a high level, when they kind of start to begin the process of puberty, we hear a lot about knees aching and backs aching, hips aching. Sure. A little bit. Is there such thing as growing pains?
Yeah, I think that just because kids are constantly changing physiologically and their musculoskeletal systems are going through such a change, especially around the puberty time. Girls tend to get tend to go through their growth spurts a little sooner than boys. So yeah, I think there's something to it. I think that boys and girls grow at different rates, and amongst that population, individuals in that population, obviously, depending on genetics, will grow at different rates and stuff. And so, yeah, I think the growth of bones puts stress and strain on ligaments and that hold joints together. So, yeah, I think growing pains can be, we all sort of, if our child comes to us and says, oh, my knee is a little bit sore and there's no evidence that he hurt himself or anything like that, we kind of blow it off and say, oh, it's growing pains, But I really do think that there probably is some physiologic component to that, especially if they're going through their growth spurt. The ligaments and other tissue that surround the joints where the growth plates are getting stretched out. And so, yeah, I think growing pains are real. And it just gets back to my point that you got to respect the pain sometimes. And sometimes it's not the healthiest thing to just have your child play through this pain that they're having. But yeah, to answer your question, sure. I think growing pains are real.
And you mentioned playing through the pain. So if it is truly growing pains that a child's experiencing, is it harmful for them to continue to train and compete through that, or are they better off taking some time away from the game and letting the body rest? I mean, these are the, having gone through this, my son just turned 18, it's very confusing to know how to read those signs and symptoms sometimes.
Yeah. I would say that if you're at any age, I don't care how old you are, if you're competing a lot, you're going to be sore, and your body's going to ache every now and then. And like I was saying before, I think that most people can kind of gauge what that, sort of tired, sore muscle is versus something else. And I think most players can gauge that too, even young players. So I think that when somebody's complaining of something, more than that, say if your son is saying, "Ow, man, my knee really hurts," and you notice some visible limping, or you notice that he just doesn't have, the same sort of power on his serve that he had before because his elbow hurts, then I am always a proponent of just resting it, especially in somebody who's growing, because what that can mean is that they are putting tension on their growth plates. Kind of depends on the age and what the joint is, because the various growth plates around the elbow and the knee close at different times in a child's life. But yeah, it usually means that they're probably irritating something, such as a growth plate sometimes. And I'm always a proponent of rest. I don't think a child should be pushed and be forced to work through a pain. And so yeah, I think rest is always a good thing to try. I will never tell a parent that they, should just have them suck it up and play through this discomfort. But again, if it's something a little more than just a routine soreness and muscle ache, I do think, consulting with an orthopedic surgeon is a good idea. But I'm all about telling baseball players and tennis players, look, I think you have an irritated growth plate in your elbow. I think you really need to lay off it for 6 weeks. And many times the patient will be, 6 weeks, I can't do it. I've got tournaments coming up and stuff like that. And the vast majority of parents seem to be very much on my side, I would say, because there's no sense in necessarily pushing it. I don't think that lack of playing that particular sport for 6 weeks is going to, cause any significant, detriment to their career as a tennis player or baseball player or anything like that. So, yeah, I'm all about the rest.
Well, what ends up happening, I think, a lot of the time, and I can't speak to any sport other than tennis. It's the only one I've experienced with, but 6 weeks is a really long time in the tennis world, especially the way the tournament schedule is right now. For a kid to be out and miss 6 weeks of training and competition can really have a year-long impact on them and their ability to, get back to prior rankings and all of that. And for a 10, 11, 12, even 13, 14-year-old, that may not be such a big deal, but for kids who are in high school and who are looking to play tennis at the collegiate level, it can really,
it can mean a season, sure.
It can. Well, there's no such thing as seasons in tennis, really. It's a year-round sport, but it can mean missing the bigger tournaments where the coaches are there recruiting.
Sure. Yeah.
Right. So, I think what we're seeing more and more now, and I actually just had this conversation with a parent of actually 4 players. One's in college now, and the others are high-level junior players. That he said he's seeing more and more kids showing up at tournaments injured and playing injured because they're scared to miss these events. And so that was why I was so excited to get you on the show, because that's a big problem. I mean, any athlete is an injury away from being done with their sport. So why would you risk that long-term, implication of letting them play injured versus taking the time away and letting them heal?
Right. And that's always been my view as well. And I throw 6 weeks out there because if it's a growth plate irritation or a growth plate injury or something like that, then typically 6 weeks is about how long it takes for those things to kind of calm down. And I think I mentioned before that there's very few problems that can continue into adulthood, but one of those problems, like I said, is not only trauma or a fracture to the growth plate, but also chronic irritation to the growth plate. And again, I don't see it as much in the upper extremity in tennis players as I do in baseball players, especially pitchers and that type of thing, or even gymnasts. But you can get to the point where you irritate the growth plate so much that it doesn't ever close. And if it doesn't ever close, then it essentially becomes an unstable piece of bone that can cause problems later on and may require surgery. And so, what we're trying to do is be able to treat this particular injury or whatever, be it an irritated elbow or tendon, ligament, growth plate, or whatever. Trying to treat it conservatively first so it doesn't get to the point where you need surgery to fix it, because then you're out even longer, But yeah, I mean, I think there's a culture that myself as an orthopedic surgeon and parents and stuff kind of are up against, and that's this, I don't know what you call it, but kind of what you were saying, showing up and playing at all costs because any time away is going to affect your rankings or stuff like that. You can't have it both ways. Many times you just can't have it both ways. You've got to respect your body and what your body is telling you. And there are natural laws that you can't ignore when it comes to healing. And it's difficult. It's difficult for a lot of players and their parents to face that sometimes, but it's a hard reality. And oftentimes it's that 6 weeks is a lot better than 3 months to a year if the injury persists and requires more aggressive management.
Right. Well, okay, so one thing that I'm hearing that's a bit disturbing is that there are players that are now resorting to growth hormones and other types of medications, I guess, to maximize their potential. And I mean, I'm even hearing about kids taking Adderall while playing. I mean, I'm hearing all kinds of stuff that just makes my skin crawl. And I don't know, if you're seeing that, but maybe you can speak to the problem with masking pain or masking injury and continuing to play through it, and the long-term effects of these performance-enhancing medications on the body's ability to heal itself and all of that.
Yeah, it's crazy. I think that it is a bad idea to try, especially at a young age, at any age, but especially starting at when you're young and not fully grown, essentially abusing medication to alter the way you play or to improve the way you play or to mask the pain that you're having. There's a book written by a famous hand surgeon Paul Brand that most hand surgeons know of, and he wrote a book called The Gift of Pain. And we've been given this gift of pain for a reason, so that we know what's going on with our bodies, so that we can kind of figure out what's going on and help it. And so if we're taking medication to suppress that, I'm not talking ibuprofen for sore muscles, or if we're taking medication to make our muscles grow bigger faster, especially while we're growing. I mean, you're setting yourself up for all sorts of potential problems, and so doing that is really really disturbing. And there was something I kind of lost my train of thought there, but there was something else I was going to mention, but it'll probably come to me. But yeah, not a good idea. And I think that the problem, which raises a whole bunch of other issues that we probably don't want to get into. I mean, both moral and ethical and all of these things about what are your priorities in life. Is the tennis that important? Is that sport that important to the happiness of your life that you're willing to risk your health to meet this end? Those are other questions, other answers to those questions.
Well, right.
Beyond the realm of this topic.
Right, but there's no question that youth sports have become big business, and so you'll have a coach, for example, say to a kid, it's just a little knee pain, it's just a little back pain, suck it up, stay out here. Yep. You'll have, sadly, some parents that do that, that don't understand that they're never going to recoup the money they've spent on their child's tennis through college scholarships. That just ain't happening anymore. But it's a frightening proposition. So I think it's really important for all of us to hear from you, that our kids' health has to be the priority, not a
Absolutely.
ranking, not a,
Absolutely. And I even at the expense of, I hate to say it because I know college is so expensive and just so, it's the college thing is so emphasized over and over again in our culture. The kid's health is a priority, even at the expense, possibly, and I dare say, at the expense of a scholarship. I'm not there yet in my kid's life. I've got 3. We haven't reached that age yet, but I'm all about prioritizing the health of the child first, and everything comes second.
Right. Well, let's switch gears a little bit and let's talk about some things that we as parents can do to help our kids prevent getting injured in the first place, which really should be the number one. The number one step is let's help them not get hurt. What are some things that we can do in terms of training frequency, in terms of equipment, in terms of recovery, in terms of nutrition, rest, all of those different aspects? Whichever ones of those you feel comfortable off-court training.
No, I'll take a shot at that. First of all, I think doing stuff like this, and where the parents can become educated on issues of the musculoskeletal system and their young athletes, so that they don't necessarily ignore that back pain that their child's having. The back pain may be a spasm, a muscle spasm, or it may be something called a spondylolisthesis, a slip disc, or a small fracture that just kind of comes about insidiously. So I think educating themselves and listening to podcasts like this, where you educate parents and whatnot about various issues. I think when it comes to training and preventing, I think it is really important to have a good coach and make sure that your child's mechanics are good. I mean, so many of the injuries that I see, I think probably come about from bad mechanics. I'm not a pro, and I don't claim to be an expert on mechanics, but one of the pros that I work with, Tyler Weeks here in Las Vegas, who's excellent. He's got an extremely strong background in mechanics and stuff. I mean, I think making sure that you have a really good teaching pro that knows mechanics, that's seen some of these players with these types of injuries, that can sort of, if a player is not too defensive about their mechanics, but willing to change, then I think changing mechanics sometimes can often produce a lot of beneficial results in getting rid of the sore elbow or the sore wrist and that type of thing. So checking your mechanics, especially if you're having some discomfort, I think is important. Educating yourself. We talked about rest. Taking the proper rest. Again, I'm a tennis player, but I never trained to the intensity of a lot of these players out there. But I knew a player growing up here in Las Vegas that would hit 1,000 balls a day, 6 days a week, and he was a friend of mine. He was always complaining of pain and always hurt and stuff like that. And so I think we can get a little crazy with our training regimens. I don't necessarily think kids should be playing 7 days a week. I think they need at least 2 or 3 days off a week where they allow their bodies and muscles to recover, because they're still growing. And so I think rest is really important. And getting plenty of sleep, and conserving that energy. So I think those are some of the pretty basic, but common sense ways of really trying to prevent a lot of these injuries.
Are you a proponent of gym work, yoga, weightlifting, Pilates, biking, any of those